Hi, this is the Dry Mouth Doctor. We're going to be talking about a case study about a severe, chronic, slow-going dry mouth case. Now, dry mouth for this patient has been going on for many years, probably at least the last 20 years, but has been slowly getting worse, and it's only really been getting worse over the last 4 or 5 years, and that's due to change of medications. It might be due to just getting a little bit older, maybe not hydrating enough, maybe she's drinking too much coffee. The point is that there's so many different little factors that lead people down a path to eventually losing their teeth. And in particular, this patient has very limited amount of teeth now. There's only the 6 teeth on the top, and now the 6, 7, 8 teeth on the bottom. And there's a lot of decay that kind of went through here, and now he has a very large infection here. It's not really worth trying to save this. It's lost so much bone. And if you look at his upper teeth, you can see that he's got a lot of acidity, wear and tear going on through here, but he also has a lot of recession and a lot of movement with his teeth due to that recession, and his teeth become extremely flared. This is a very big flare of his teeth going out and coming in here. And so this case is not just, okay, well, I want to spend money and then try to fix the teeth, but this case is extremely difficult for the dentist to deal with, whether it's prosthetics or natural teeth, how this angulation comes together. So this case study is going to talk a little bit more about some of the decisions made on how to treat this case now that things have gone further than you would want to try to restore it by traditional dentistry, doing what I call tooth by tooth dentistry, doing fillings and crowns and bridges. He's well beyond that. So this case, he knows that he is a double denture case. I'm going to note something about double denture cases here. I do full mouth rehabilitation cases, and many of you have heard of Clear Choice. Clear Choice has kind of adopted the idea of doing teeth in a day and all on 4, that kind of notion. Most dentists do a lot of similar things. This is a case that you can justify saying, yeah, I think maybe teeth in a day would be worthwhile to maintain this person's quality of life. This situation where he has the angulation problem is something that will need adapting to regardless of teeth in a day. So it's not just a strict model of following a protocol, but in this case it's very difficult because of that angulation. You have to reposition those teeth so that you don't have that angulation. This one, that ridge is going to come in. You want the teeth coming more above that ridge, and on the upper one you want to do the same. So your teeth, if this is the tooth edge here or this is the tooth edge there, you want your teeth to come closer to what we traditionally call that anterior positioning, where it's more of a scissor like bite in the front, like this, than having a flare and angulation that's going to dislodge or break your prosthetic that you're loading, because they're just implant supported. They don't have the sensitivity and the feel and the feedback mechanisms your natural teeth have. When you go to dental implants, there is no natural feel, and in this severe angulation situation, you will more than likely break, crack, or chip the prosthetic within 3 to 5 years. So I'm going to talk more about this case. I'm going to talk about it more as an upper, and then another video to talk about the lower. Great. Thanks. Hang on there. This is Dry Mouth Doctor, and stay tuned and keep following this case. Thanks.